Hi viewers, in today's video we'll discuss about obesity, meaning of obesity, causes and the health problems we face due to obesity. Obesity means a person's body weight is more than what is considered healthy for his height. It is the balance between the energy intake and the energy utilization. Energy utilization can be in any form of physical activity, resting metabolic rate, and the thermic effect of food. This usually decreases with age. And that is the reason where you need a healthy balanced diet which comprises of different kinds of foods in a particular quantity and proportion to meet the requirement of calories, proteins, fats, minerals, vitamins and micronutrients. So, when energy in is less than out, we lose weight. When energy in is same as out, we maintain the same weight. When energy in is more than out, we gain weight. Now, let us have a discussion on the causes of obesity. Ethnic differences, familial clustering, specific genetic markers play a major role in cause of obesity. There is also a high concordance in rate of twins. Even though the genetic factors do not have a much interference with obesity, familial habits and dietary patterns play a major role in obesity. Sedentary lifestyle is a major cause for obesity. Inactive lifestyle burns no calories, so active exercises is needed to avoid obesity. Diet high in calories and sugars are a major contributing factor for obesity. Intake of high calories, especially at night, skipping of healthy breakfast, replacing it with a junk food or a fast food, all factors can increase obesity. Sleep deprivation is also a major contributing factor for obesity. It causes disturbances in the hormone levels, which also causes wrong eating habits, which lands with obesity. Depression and fatigue play a major role in obesity as it causes hormonal imbalances and decreased physical activity. Some people have a defense mechanism of overeating during the episodes of depression, which also ends up with obesity. Emotions, particularly anger and excitements, increase the appetite level, which naturally ends up with obesity. Evidences also suggest that there is an increased appetite during menstruation, which also lead to obesity. Media plays a major role in advertising junk foods. The vision and the presentations keeps tempting individuals to eat junk foods with no nutritive values, leading to obesity. Now let us see the types of obesity. Obesity can be either apple-shaped obesity or pear-shaped obesity. Apple-shaped obesity. In apple-shaped obesity, the weight gain is usually above the waist, so the individual presents with excess fat around the belly. It has more visceral fats. Apple obesity is usually associated with metabolic syndrome and has a high risk of health problems. Whereas in pear shaped obesity, the weight gain is below the waist, so the individual has excess fat around the hips and thighs. It has less visceral fat. Pear shaped obesity is less commonly associated with metabolic syndrome and there is a decreased risk of health problem. So we can have a judgment in which type of obesity we belong to. Calculation of obesity is usually done with the simple formula of BMI calculation. That is, BMI is equal to weight in kg by height in meter square. For example, if we are going to calculate BMI for an individual with a weight of 60 kg and height of 160 centimeter, BMI is equal to 60 divided by 1.6 into 1.6 equal to 23.44. This calculated BMI must be compared with the standard obesity scale. That is, if the BMI is below 18.5, you categorize as underweight, 18.5 to 24.9 normal weight, 25 to 29.9 overweight, 30 to 34.9 class 1 obesity, 35 to 39.9 class 2 obesity, and above 40 class 3 obesity. Now let us see the health problems we face due to obesity. Type 2 diabetes is a major and a common health problem we encounter due to obesity. Hypertension or increased blood pressure may be a primary health issue due to obesity or can be secondary due to diabetic mellitus. Hyperlipidemia or increased cholesterol level is a major health issue arising due to obesity, leading to cerebrovascular accidents in many cases. Angina, heart attack, coronary artery diseases, atherosclerosis, any of these can happen as an effect of obesity. Obesity during pregnancy can cause hypertension, diabetes, what we commonly call as gestational diabetic mellitus, preeclampsia or eclampsia in pregnant women. These conditions can put both the mother and the child into complications during pregnancy and even after the delivery of the baby. Obesity in pregnancy can land up with childhood obesity and juvenile diabetic mellitus. To prevent childhood obesity, the pregnant women must remember these key points. Pregnant women do not need to eat for two. The total energy requirement for pregnant women is usually 10% more than the maintenance. In first trimester, there should be no weight gain. The weight gain usually begins from the second trimester and increased weight gain is noted in the third trimester. Low GI carbs and essential fatty acids, that is your linolenic acid and alpha linolenic fatty acids, should be the part of the macronutrients intake. The next step to prevent childhood obesity is weaning. Weaning should be started at the correct time and should be emphasized on the quality of food and not with the quantity of food, which must contain all micro and macronutrients. That is the end of the session, and management of obesity will be dealt in the upcoming videos. Thanks for watching and subscribe for more videos.